Welcome to Medical Minutes here on DMG TV2. This time around, we'll start out at the New Philadelphia City Health Department, where Health Commissioner Vicki Iono will talk about the cold and flu symptoms since it is that time of year. Then we'll go over to the Tuscarawas County Health Department, where the communicable disease reporting nurse, Amy Kaiser, will talk about everything from pertussis to measles to sexually transmitted diseases and even Ebola. We finish here at the Ohio Head and Neck Surgeons, where Dr. Kent Ramsey explains sleep apnea, all coming up on Medical Minutes.
Hi, I'm Elaine Miller with Naturally Green Cleaning Service. My company serves both commercial and residential clients. We do general cleaning, spring and fall, empty homes to get them move-in ready, and final cleans for new construction. We use eco-friendly cleaning products that leave your home or office fresh, clean, and safe for you, your family, pets, or coworkers. Our focus at Naturally Green is to provide excellent customer service paired with outstanding work to build a relationship of trust with you, our clients. Having served the area 4+ years, we have had many referrals and testimonials that you can access on our website at www.naturallygreencs.com. Our work sells itself, therefore we have never had any contracts even with our largest commercial accounts. Call us today for your free quote and see what makes our company stand out.
Hi, I'm 1450 WJER's Bill Morgan, inviting you to join me on television Wednesday evenings at 7 and Friday afternoons at 5 for TV2 Sports Talk. Sports Talk is your weekly look inside high school football, volleyball, soccer, and more. Look for guest appearances from your favorite area coaches and players. TV2 Sports Talk, Wednesday evenings at 7 and Friday afternoons at 5 on DMG Channel 2 on Time Warner Cable.
Welcome to Medical Minutes here on Time Warner Cable, DMG TV2. This edition, we are talking about all the things that make you sick. And we're going to start out here at the New Philadelphia Health Department with the City Health Commissioner Vicki Iono. And the first thing you think of this time of year is cold and flu season. What is it about this time of year or the weather that makes us sick?
Well, now this time of year we're indoors more and we're around people more because of the holidays, and we're spreading our germs and our bugs a little more.
I would think I wouldn't catch anything because I'm all holed up inside.
No, you're still getting out more than you think. You go to church, you go shopping, you touch the shopping carts, you touch things that people have touched, bathroom door handles, sink knobs and flushers and all kinds of things.
And so when you get a cold, what do you do about that?
Well, a cold, is a virus, as many illnesses are viruses, and they really have to run their course. You're looking at 10 days to 2 weeks of being sick. We usually with headache and sneezing and sometimes coughing, and you can treat the symptoms.
But you just have to wait, like you said, a week to 10 days, and you'll feel better then. How do I keep going? Should I stay home for that amount of time?
Well, I think that you have to decide how sick are you. Are you fevered? Then you want to stay at home. If you're not fevered and you're just, a little congested or something, you can go out and about. Frequent hand washing, though, has got to be the key.
Now, what's the difference between having a cold and having an allergy? Because you can have allergies in the wintertime, right?
Yeah, you can have allergies year-round. Allergies means that your body is reacting to something in your environment. And you usually will have that runny nose. Usually it's a clear drainage from your nose, sometimes a little cough from the drainage. And that won't go away after 2 weeks. And it's a long-term thing. And unless you go and have testing to see what you're allergic to, and then start treatments for that.
Now, most of the over-the-counter medications that you would take to stop your runny nose or stop your cough, they make me sleepy, so I don't want to take them.
Yeah, there's different things over the counter that are available. Some things make you sleepy, and that's best to do it only when you can stay at home and lie down. But there's other things that you can buy that are non-drowsy.
And I can keep going and go to work and pick up kids from school and do all that.
Unfortunately, in the real world, we have to keep moving, don't we? And it's hard to stay at home and lose work and lose time out of life. So you really can keep going as long as you're not fevered and you don't think you're really spreading it to others.
All right, now you told us all kinds of ways to catch a cold and get sick. How do you avoid it?
Well, you avoid it by trying to wash your hands as frequently as possible and keeping those hands away from your eyes and nose, because that's how usually you give it to yourself. You get it on your hands from something and then you touch your eyes or nose, or sometimes your food and ingest it that way. So you want to wash your hands really frequently and try to avoid people that you know are sick.
Now, what about all the different types of like hand sanitizers and little wipes that you bring? Is that overkill?
No, that's actually a good idea. Hand sanitizers is wonderful when you don't have water available to you, soap and water. Also, the hand wipes or the Clorox wipes that are available at especially your stores at the entrance where the carts are kept. It's always a good idea to wipe that off because you're not sure who had it or sneezed on it or touched it before you.
All right, now when we move to something a little more serious, so if you don't just have a cold, what about the flu? Now, what I call the flu might not be actual influenza, right?
That's true. Influenza is a specific virus. Its full name is influenza. Everyone calls every little virus that they get the flu. If you've been sick only 24 hours, then it's not the flu. You've had a virus, but it's a 24-hour bug. Influenza actually puts you out of life and work for a good 2 weeks, week to 2 weeks. On average, you're miserable. You have a fever. You usually have body aches. You have joint aches. You chill. You just, have watery eyes and just feel lousy. And
Kind of intestinal.
sometimes intestinal. Often influenza isn't intestinal, though. If you get an intestinal bug, it's usually a different virus.
But if I just have a 24-hour bug, what do I do about that? Just stay home in bed?
Yeah, treat your symptoms and, watch. And if you're feeling better the next day, that you did have a virus of some sort, but it wasn't influenza. But influenza you can avoid by getting your flu shot.
And is it starve a fever, feed a cold?
When you're sick, you really need to push fluids because often you don't feel up to eating very much or so fluids is the way to stay hydrated and then take over-the-counter medication for your symptoms.
When do you need some prescription medication like that Tamiflu? Isn't that prescription?
There's some antiviral medications. You have to start taking them within like 48 hours of actually your symptoms, or they're really not all that effective. Most of the time it's going to run its course.
Now, what about when you have that first sign of a cold? There's all kinds of medications that say, "Hey, we can keep the cold away from you if you take that medication right away." Does that work?
Well, some of the over-the-counter are very good for some people. Not all of them affect people the same, and some work better than others. Yeah, I'd talk to your pharmacist about that.
So if I eat a bunch of oranges, I won't keep the cold and flu season away?
I mean, it's obvious that if you're healthier, you eat well, sleep enough, get plenty of rest and work out and stay as healthy as you can, you're going to avoid a lot of illnesses. And of course, washing those hands.
All right, all good advice. And the cold and flu season, how long is this going to last?
Well, we're starting to see cases, not so much in Tuscarawas County right now, but we are seeing it in southern Ohio. There's lots of hospitals reporting influenza cases. It's just a matter of time till it gets to us. It's still not too late to get out and get your flu shot.
All right, all good advice from the New Philadelphia City Health Commissioner, Vicki Iono. And for Medical Minutes, I'm Jennifer Clark.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, Newcomerstown, and Millersburg. Let's get started building our relationship.
Searching for quality bottled water? Call Crystal Springs Water Company. Crystal Springs Water is a family-owned and operated company that's been proudly serving the community since 1986. Crystal Springs offers a quality bottled water in a variety of sizes to suit your everyday needs. They also carry a selection of water coolers, cups, bottle racks, hydro pumps, and premium water softening salts. All available for pickup or delivery. Call Crystal Springs Water Company today.
Welcome back to Medical Minutes here on DMG TV2. And this time around, we are at the Tuscarawas County Health Department. We are talking with Amy Kaiser. She is the Communicable Diseases Reporting Nurse. So if you have a disease, Amy wants to know about it and she'll report on it, right?
I sure will. It's a requirement for the Ohio Department of Health. Yeah.
Who do you report to?
I actually report to the Ohio Department of Health through a computer system that tracks all the different communicable diseases in the state.
Now, there's colds, there's flus, but there's really some more serious diseases that go around. Things you can be immunized against, like pertussis, but we still have it.
Correct. We still have pertussis. We've had a couple of cases recently, and a couple cases outside of the county as well, so it's still out there. So it is important to get your immunizations if possible, and sometimes too, even if you do get your immunizations, you may end up with like chickenpox or something like that, but you may have a milder case of that particular disease. So.
Now, I've heard of chickenpox and measles and mumps, but what exactly is pertussis? Whooping cough?
It is whooping cough. It starts off like a cold, so you may have like cold signs and symptoms at first, and then after a couple weeks into the cold, it's just not going away, and then you start with that cough, that whoopy kind of cough, and that's when you really are contagious for up to 3 weeks. But if you go to the physician, get your antibiotic like you're supposed to, there's a blood test that they do to diagnose it for sure, and they will test that individual patient and their close contacts as well, just as a precautionary measure. And once you start the antibiotic, within like 5 days, that communicability kind of decreases some. So it is important to follow up with your physician, especially if you're starting to notice that whoopy kind of cough. It's very important to isolate the patient right away and those around you, and make sure you're updating your close contacts so that they can kind of be on the lookout for any signs and symptoms as well.
And measles and mumps, there have been reported cases in Ohio where it seemed to be kind of an outbreak.
There was an outbreak in Holmes County earlier in this year. However, it was from a couple of folks that had gone to the Philippines on a mission trip, and there was an outbreak in the Philippines. And these particular folks were not immunized, so when they came back, of course, you know, it's very communicable, and it did end up into an outbreak, and something that Holmes County and Knox County and a couple other surrounding counties dealt with, and our department helped do a lot of immunizations and clinics and stuff as well. So it's under control now, though.
Right, we were able to stop it.
Yes.
Another disease that went around and everyone was worried that all the kids would have is tuberculosis.
Yes, we did have, you know, an episode here where we had to deal with some TB issues. And again, there is that worry about having tuberculosis. However, people need to realize there's a lot of steps in diagnosing tuberculosis, and just because you may have a positive skin test doesn't necessarily mean you're active, doesn't necessarily mean that you're contagious at that point. It just means we have to do some follow-up, do some further testing to identify for sure what's going on with that individual.
And remind us again, what is TB?
TB is an infection that actually is in the lung, but it can also affect any organ in your body. It can infect your lymph nodes, your liver. I mean, it can infect anything. That's mainly the non-infectious type. The main infectious type is when the bacteria settles in the lungs. And of course, it's communicable because even with me talking, I could be spreading it if I was active. So the sneezing, the coughing, that's why we have to isolate, quarantine, set people aside for a while until we know for sure what's going on. But there's a lot of steps involved. It's not a very cookie cutter kind of program.
And did we had some of the schools voluntarily said, hey, if you want a voluntary test for TB, they sent out the little robocalls that said, hey, go to the health department or come to the school. And we had a couple schools do that, right?
We did. Earlier in the year, well, actually, when I first started here in September, we did have some schools that did some voluntary testing. And so we did test probably over 1,000 people. So when you test over 1,000 people, of course, you're going to stumble upon some things that need to be dealt with, which we have dealt with. And that, again, doesn't mean they were necessarily confirmed cases, but there were some things that we had to follow up on.
Which also leads us, when you said quarantine, I think of the Ebola virus, which mostly is overseas, but when 1 or 2 people come into the United States, everybody panicked.
Everybody did panic. It was something new. It was something our country hadn't seen on our soil before. So, you have training, you have the PPDs that you're supposed to wear and everything, PPEs, I'm sorry. However, it was something that we weren't dealing with every day. So, on the air of precaution, they decided to take some extreme measures just to make sure everybody was safe. However, the risk of people like us getting it was probably very rare. We were more up to get like the flu and have issues versus getting the Ebola. They're still doing monitoring of travelers, and they're coming into 5 different airports within the United States right now, and they are giving cell phones and doing the 21-day monitoring, depending on where they were and what they're doing. And again, CDC's kind of leading the way on that and trickling it down to like our Ohio Department of Health that goes to that particular county, wherever that person's going to come into.
And then there was a woman that flew into Cleveland and flew back out. And of course, there was a couple people from Dover on the plane. But everything turned out okay.
Everything turned out just fine. They did what they were supposed to do. They monitored themselves appropriately. They volunteered to do that, and they were fine. Yeah.
All right. Now, some more common diseases are sexually transmitted. And here in our area, chlamydia is a particular problem. What is that?
Chlamydia is an STD that is transferred through sexual intercourse, and it is a bacteria that can be treated with antibiotic. It is very important to be treated if you do find out that you have this. It's a silent infection. A lot of times you may not have signs and symptoms. Sometimes you may. And once you find out, it is very important to have the treatment, do the 3-month follow-up, recheck if need be, make sure you're letting partner or partners know that you have it because they need to be assessed and treated as well. Very important to abstain during that time frame, or all you're going to do is share it back and forth. And also for pregnant women, that's why they're tested throughout their pregnancy, because as the baby's coming through the birth canal, of course, that can infect the baby as well. So we do have to, it is a very serious thing. Women can get pelvic inflammatory disease, have some other issues if it's gone on for a long time.
But it's a problem in our area. How come?
Not just our area. It's actually one of the highest reported ones in the United States right now. So it's a very common infection. But again, it's probably because partners aren't communicating and doing the follow-up treatment like they're supposed to, or doing that follow-up retest.
All right, and then syphilis and gonorrhea, are they still a problem?
I've seen some gonorrhea since I've started here, and a few syphilis, but the chlamydia is the biggest offender right now.
And I also think about herpes too. That's pretty contagious.
Yes, herpes is contagious. Any of the STDs are very contagious, that they do all require follow-up with your physician, letting partner or partners know of the infection so they can get treated and followed up as well, and doing that follow-up. Making sure you're taking your antibiotics as prescribed is another big thing. If you're not taking them correctly, then
I think just getting them to the doctor in the first place will be hard enough.
Yeah, sometimes they are coming because by the time they do, or we may see them, or a doctor may see them, they may be having some symptoms, and it can be very painful.
All right, and all of these diseases, they can all be prevented?
A lot of them can be. A lot of them can be prevented with the vaccine, with good hygiene techniques, with getting your vaccinations if need be. And again, you may still get some of these things, but it might be a milder case of those. And if you're asked to stay home, stay home. If you're asked to follow up with your doctor, it's important to follow up. So a lot of these can be at least contained.
All right, very good. Amy Kaiser, she is the communicable disease reporting nurse here at the Tuscarawas County Health Department. And on Medical Minutes, I'm Jennifer Clark.
I'm John Maselli, and I would like to welcome you to the Sunnyside Store restaurant. Since 1999, we have served over 500,000 meals. We specialize in steak, pasta, and the patron special, ribs. The Sunnyside Store is located at 5495 North Worcester Avenue in Parral. Hours are Monday through Friday, 11 a.m. to 10 p.m. Sunday, we open at 9 a.m. for breakfast. For more information or to schedule an event in the banquet room for groups of 40 or smaller, call 330-364-5474. This is John Maselli inviting you to the Sunnyside Store restaurant.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, New Comerstown, and Millersburg. Let's get started building our relationship.
Welcome back to Medical Minutes here on Time Warner Cable DMG TV2. On this segment, we're going to talk about something called sleep apnea. We're at the Ohio Head and Neck Surgeons in Dover, and with us is one of our specialists, Dr. Kent Ramsey. Welcome.
Thanks, Jennifer.
Now, let's start out by explaining what is sleep apnea, because I think it's just snoring.
Well, yes and no. Everyone who has sleep apnea has some degree of snoring, and sometimes it's terrible snoring. But a lot of people who snore don't have sleep apnea. Think of snoring as being a partial blockage of your airway, partial obstruction. When you sleep at night, all your muscles relax, and that causes the tissue to collapse together and block your airway. When you snore, you don't completely block your airway, you just block it partially. You can still move air in and out of your throat, but it might sound like you're choking or gasping for air. When you have sleep apnea, on the other hand, you actually are choking or gasping for air. The airway collapses completely shut. So it's different than just snoring. And when your airway collapses shut, you basically stop breathing. The word apnea means no breathing. That's what that word means. And if you stop breathing for 10 seconds or longer, that's considered an apneic event. Some patients will stop breathing for a lot more than 10 seconds. They'll go 20 seconds, 30 seconds, even longer without breathing, with apnea. And when you stop breathing for that long, I think you can clearly see it could be bad for you. Your blood oxygen level can drop significantly while you're not breathing.
And it can be fatal.
Yes, it can be fatal, but fortunately that's quite rare. Most fatalities with sleep apnea would only occur if there was a comorbidity involved. That means another health problem. For instance, if you have a bad heart disease, and you have a prolonged apnea spell, your oxygen drops very low, your heart could stop beating during that apnea spell and you could die. But that's pretty rare. The more significant side effects, in my opinion, of sleep apnea are the ones that result from the loss of sleep. People who have sleep apnea are tired all the time. They have chronic fatigue because they never get a full night's rest. And when you're tired all the time, that can lead to poor performance in school or on your job. It could also lead to falling asleep behind the wheel and having a car wreck.
So when you have sleep apnea, do you wake up because you're not breathing?
Your body may partially wake up. You may not come to full mental alertness in the middle of the night, but you never get into the deep sleep stages that are going to restore your sense of well-being and make you feel rested. You will partially wake up just enough to move around and restore the opening of your airway and start breathing again.
So how do you know if you have sleep apnea if you're asleep when it happens?
Well, there's two ways you might know. One, you could call the couch test. If you find yourself waking up on the couch every morning because your spouse kicks you out of the bedroom, that gives you a pretty good clue that your snoring is so terrible you may have sleep apnea. But many times a patient will come in at their spouse's insistence. Their sleeping partner will tell them that they actually stopped breathing during their sleep. Another thing that might let you know that you have sleep apnea is that sense of fatigue, being tired all the time. If you tell your doctor, I'm exhausted, and he's ruled out thyroid disease or anemia or depression, other things that could cause fatigue, he may recommend a polysomnogram test or a sleep study. That's a test where you spend the night in a lab with some technician watching you sleep.
How do you sleep when somebody's watching you?
It's not easy, but if you get tired enough, you'll still fall asleep. But that will tell you for sure if you have sleep apnea, a polysomnogram.
Now, is it only in adults? Do children have sleep apnea?
Well, we see it in men and women, young and old. Anyone can have sleep apnea. It's a little more common in men than women, but we see that in both sexes and all ages. In children, the treatment for sleep apnea is a little different. Most all children can be cured with a tonsillectomy and adenoidectomy, whereas in adults it's more complicated.
Yeah, what's a CPAP?
CPAP is the gold standard of treatment for sleep apnea these days. CPAP stands for continuous positive airway pressure. It's a machine, basically an air pump that pumps air under pressure through tubing and a tight-fitting mask into your airway, and it prevents the tissue from collapsing closed and obstructing your airway. The beauty of CPAP is that it works 100% of the time.
How do you sleep with that on your face?
Yes, there's the if. It works 100% of the time if you use it. Most large studies of CPAP patients shows that compliance is very poor. Most people use it maybe half of the nights at best. And if it's sitting on the floor or in a closet, it's not doing you any good at all. But if you wear a CPAP machine, it will fix your sleep apnea.
Now, what about surgery? Can you surgically fix it?
Yes, there are surgical options that can be recommended. Basically, surgery would be directed at relieving a blockage or an obstruction in the upper airway. If you have large tonsils, we would take those out, or an elongated uvula, the little punching bag that hangs between your tonsils, we could snip that off for you. Some patients are retrognathic, meaning the jaw is pushed back. They have a weak chin, and that causes the tongue to be pushed to the back of the throat. That can be fixed with a big operation called a maxillomandibular advancement, where they break the jaw and pull it forward. There are other surgeries as well. Surgery for sleep apnea, though, is not as successful as CPAP. We get about 50% cure rate with surgery.
But with CPAP, it's 100%.
If you use it. There are some other treatments too besides surgery and CPAP. There are dental appliances or an orthotic splint that can be worn to help pull the jaw forward during sleep, to pull the tongue away from the back of the throat. Another treatment for sleep apnea is weight loss. We see sleep apnea commonly in the obese population. When people are very heavy, it can lead to obstruction of the airway and sleep apnea. So getting down to your ideal body weight through a weight loss program could be another treatment.
So another benefit of losing weight.
But unfortunately, it's easier said than done to have permanent, long-lasting weight loss. That's not such an easy thing.
All right, so if you're tired, find out why you might have sleep apnea.
Exactly.
Thank you very much, Dr.
My pleasure.
Dr.
Thank you, Jennifer.
Kent Ramsey here on Medical Minutes on DMG TV 2.